Okay.
Timer is on, and here is the question. Right, so if you've read and understood, kindly tell me, how would you explain the pathophysiology or pathogenesis of patient's condition to patient?
Okay, it might be due to H. pylori infection, or it can be due to using of non-steroid and synthetic drugs or smoking.
Okay.
Due to H. pylori,
All right.
the bacteria neutralize the gastric content of the stomach
Yes.
by using of the urease enzyme. This urease converts urea to ammonia, which increases the pH, so the bacteria can survive the gastric content. This substitutive series of the toxin called CAG and BCA, I think. This is adhered to the mucosa and causes mucosal inflammation, which leads to ulceration.
Okay. Can you tell the patient what are the risk factors for the development of this condition, and how
This
should that
factor
patient modify its lifestyle?
can be smoking
Yes.
and using non-steroid anti-inflammatory drugs, and
Yes.
also due to H. pylori infection,
Yes.
may due to corticosteroid
Yes.
use.
Stress, and the most importantly, use of alcohol.
Smoking and
Okay.
alcohol, yes.
You said H. pylori infection. What is H. pylori?
This is gram-negative spiracy.
Yes.
Gram-negative microaerophilic spiracy,
Yes.
which is found in the stomach.
Yes. What test can be done to confirm this?
To confirm, we can use invasive tests or non-invasive. Non-invasive, we can use a urease test or Campylobacter like sign
Okay.
test. We can use also invasive OGD with biopsy.
Yes. How these tests are done?
The Campylobacter, usually we do gut through duodenoscopy with taking biopsies. This is put in the medium,
Yes.
contains urea and indicators such as phenol rate. If there is bacteria, this will release urea. This confirms urea to ammonia. This lead to increase the pH. Then will convert to color to the red. This means this is the positive test.
Yes. Okay. This patient had 2 episodes of hematemesis. Can you tell me why patient vomited or why patient had hematemesis?
Due to the ulceration, which leads to erosion of the blood vessels.
Okay. What is ulcer?
Ulcer is the break in the skin or mucous membrane, which
Yes.
leads to loss of the tissue surface and
Yes.
disintegration and necrosis of the vesicle.
Okay. What might have caused hypercalcemia in this patient?
Patient might have parathyroid adenoma, or
Okay.
may have malignancy, or may have Men's syndrome.
What is Men's syndrome?
It's multiple endocrine neoplasia.
Yes.
It has many types. The autosomal dominant condition.
Yes.
May have type 1 and type 2. Type 1 patient usually presents with the 3B,
Yes.
adenoma, and parathyroid hyperplasia.
Yes. How should that patient be managed?
For this patient, we have to
With Men's
do
syndrome, yes.
Men's syndrome, we can do total thyroidectomy
Yes.
with neck dissection, and if there is adenoma in the pancreas, we can do also adenectomy.
Okay. There's too much noise.
Then
Or yes, can you tell me what are the classical symptoms with which a patient with hypercalcemia presents?
hypercalcemia patient usually present with bone pain and muscle weakness, sleep disturbance. Patient might be lethargic or it can be psychic change.
Okay. I want to hear those
Maybe
moans and groans. Yes.
moans and groans. Yes.
Yes. Why the patient presents with kidney stones?
Because there is a formation of the renal due to hypercalcemia, which leads to hyperoxaluria.
Yes. Okay. And why the patient with hypercalcemia presents with painful bones? Why do bones become painful?
It is due to increase the osteoclastic activity, increase the bone resorption,
Yes.
due to hypercalcemia.
Yes.
So the bone becomes fragile. There is the density.
How would you classify the causes of hypercalcemia?
Hypercalcemia can be associated with increased parathyroid hormone, can be due to primary hyperparathyroidism or secondary or
Yes.
tertiary.
Yes.
Can be due to familial hypocalcemic hypercalcemia, or it
Yes.
can be due to vitamin D toxicity and maybe some granuloma such as sarcoidosis.
Yes.
Also, it's associated with some drugs such as thiazide and can be also associated with immobilization.
Yes.
Due to malignancy.
Yes. You said if patient has Men's syndrome because of parathyroid adenoma, you'll do the procedure. Then what kind of parathyroidectomy you said can be done? Then how would you
So
confirm your
we can use the
diagnosis?
STEMI scan or frozen section. I
Yes.
will do total parathyroidectomy.
Yes. Okay. How would you confirm your diagnosis?
By using the STEMI scan or frozen section scan. Also,
Okay.
you can use
What is
ultrasound guided
frozen
finding
section? Can
arrangement.
you please explain? How is it
This is
taken?
a pathological laboratory procedure to perform
Yes.
rapid analysis of the specimen. The specimen is put in the metallic disc, then
Yes.
it's secured on the jack. Then it freezes to -20 or -30 degree.
Yes.
After that, we put it in the medium contains the gel-like medium contains the polyvinyl alcohol or polyethyl glycol.
Yes.
After that, we can cut it using something called microtope. Then
Okay.
we put it on the glass slide and we can use stain, H&E, which is hematotoxin or
Yes.
leucine stain.
If
The
you'll
slide
yes,
okay.
if you'll do the histology, what would you see?
The parathyroid adenoma, I will see the uniform cell of polygonal cells, of T
Yes.
cells, and also there may be a large cell of basophil and non-neoplastic parathyroid tissue at the edge of the adenoma, separated by fibrous duct.
Okay, good. Can you tell me one last question? Bell has gone, but still, how would you manage this patient?
For the this patient has hypercalcemia and
Yes.
hematosis.
Yes.
For the
So what should be
hypercalcemia,
the treatment? Yes.
we can give him bisphosphonate or diuresis or IV bamidronate. Also, patient might need vitamin D. for the hematemesis, we should do OGD with the adrenaline injection to
Did
secure
you
the
mention
ulcer.
hydration? Hydration for
No,
diuresis?
yes.
Okay. And yes, because calcium is more so IV hemidronate and calcitonin and bisphosphonates. Okay, good.
Thank you.
Thank you so much. Yes, maybe you can read a little bit more on how it affects, how all symptoms are presented, how it affects all the body organs, and what is the mechanism behind, just for your own clear concepts. Yes, thank you so much. Anyone else want to give feedback to Dr. Mohammed?